Apologies for that technical fault there. Well, the power play at the Greater Accra Regional Hospital at Rich here in Accra is deepening. This afternoon, the man tasked to take over from the embattled medical director at the hospital, Dr. Emmanuel Sofenyo, has chaired his first meeting as he prepares to take full charge of the new facility on Monday. Dr. Sofenyo has been speaking to JoyNews' Zarina Amandi after that meeting with heads of departments.
The hospital has been operationalized, and you saw the program on TV the last time. However, to move there fully and physically, we have to follow a plan. And we've finished completing on that plan. We've put the plan together. And from Monday, we'll be physically present in the facility. It's one thing being within the facility, but it's one thing also receiving patients and performing surgeries and making sure that all those other services are being rendered. So these are the other things that we are putting in place currently, so that by Monday, physically, when you come there, you will see that service is being physically delivered. On a daily basis, we are having meetings to plan the full transition into the place.
Dr. Emmanuel Sofenyo there. Well, all these are happening despite strong objection by the substantive medical director, Dr. Thomas Anaba, to the health minister's directive transferring him. He spoke to JoyNews' Hannah Odame in this exclusive interview yesterday.
My legacies, several. I have devolved a strategic plan for the hospital within 1 year.
Are you sure there was none prior to your company?
There was none. They were going to move the hospital without a strategic plan. Yeah. I've devolved a training.
You mean for the new facility?
Because I was appointed to transition the hospital into the new facility.
Okay, so there was a strategic plan for the Rich Hospital.
There wasn't.
Since the inception of Rich Hospital?
There's never been a strategic plan.
Okay, yours was for how many years?
I developed a 5-year short-term strategic plan.
Okay.
And I also developed clinical protocols. Clinical protocols is to guide every doctor what to do for every particular disease. You don't deviate from that. Not that I know this is how I do it. No, you do what is supposed to be done. I've also developed administrative protocols for this hospital, so that if you are entitled for something, you get it. If there's a problem, we need a committee to be formed. The committee is already there and the designations are there. If you want a leave, there's a way of going for leave. We've devolved that one too for the hospital. I've achieved by devolving what we call a blood servicing unit in the hospital, that we process our own blood and we have relieve ourselves from the National Blood Bank Service for erratic and expensive blood supply to the hospital. And as I tell you, in 2016, no single patient died in this hospital as a result of lack of blood.
Not even from the maternal unit?
Yes, the maternal unit, 6 of them died, and the 6 who died were referred from other places in critical conditions, so they had multiple organ failures before coming here. So that is an achievement. I've reduced maternal mortality. I've reduced under 5 mortality. I have developed what we call a costing tool for the hospital to determine the prices of things in this hospital. We have also developed what we call an operationalization, financial operationalization software, whereby our budget will be in a software that if you want money, you state where you want the money from, whether you budgeted for it or not. So we control expenditure. I've blocked a lot of leakages. We were spending almost 30,000 a month to repair air conditions in this hospital.
And now?
And now we are paying one man just 1,000 cedis.
So you think
to service all this and to buy minor parts to fix. So we spend less than 5,000 a month in repairing air conditions. That is enormous. All vehicles now have notebooks inside the control books to calculate their mileage and fuel consumption. Procurement of food items to the kitchen, we've reduced it by half. By half, and the records are there.
So where were the monies going at first?
They inflated the prices, and I called the people and abrogated the contracts. All these things, I think, that's why the kitchen staff were protesting. And we have a canteen that is causing a tremendous loss to this hospital that I proposed to outsource. That is what caused the uproar in February, and they went to meet with the minister. That I'm selling the canteen for myself. You have 14 workers in the canteen who, after working for a month, will bring to the hospital 2,000, 3,000 cedis. You can't use it to even pay them. And you have to cough money to pay their salaries. So you do a cost-benefit analysis, you want to outsource it, but because they have relatives who are in TUC, Health Service Workers Union, and journalists, they go and team up and write allegations that are unfounded against you. That is this country. That is the country we are in. That is the rich hospital I want to change. That is what is bringing all these things towards me. But the sad thing is that the minister is relying on weak.
Okay, before we go to that, so you think that because you're strict or you've brought some form of discipline according to what you're saying, that's why you're not being liked, and so people are going behind you to
that's why I'm not liked by those who want to indulge in that. Not everybody.
Okay.
Many people like me in this hospital.
Okay, so let's go back to the minister, because he said he gave you 3 reasons.
Yes.
And you mentioned before.
He gave me one reason that he's going to restructure the hospital in his letter, and gave another reason.
You are not part of the restructure.
Yes, and gave another reason that he's transferring me.
Okay.
So it is not a sack.
Okay.
That is another. He gave another reason that the Bouygues company indicated that I'm not competent to manage the place, so he should remove me. He also gave reasons that Public Service Commission approving me was not right because I don't have managerial skills.
Indicate that it is what they tell you. All right, so as the power play continues, how is healthcare delivery affected at the newly inaugurated Greater Accra Regional Hospital? My colleague Zarina Mandi just returned from the hospital. He joins me in the studio for more. We'll find out from him beyond this meeting, what's the situation there. But before we do that, was Dr. Thomas Anaba at work today?
Okay, so I went to the hospital administration to find out, and the information I got was that he did not show up. I tried to find out from some of the staff there, and no, he's not. Actually, what they told me is that he's not there.
He's not there, so he's not, and they weren't willing to engage you any further.
They were not willing.
Right, let's come to the acting medical director, Dr. Shrofenyo. You spoke to him as well today. Did you speak to him about the possible effect of the standoff on healthcare delivery?
Actually, he is saying that it has got nothing to do with healthcare delivery. He's actually very confident that there's nothing, it's not affecting their job, and then they are working in the hospital. So they're assuring patients that everything is going on as usual, everything is normal, and so they should not be worried at all.
But then you also spoke to the staff. Of course, that is the acting medical director's version of the story. Yeah. You spoke to some of the staff about what could happen if this standoff should continue. What did they tell you? Okay,
so a huge majority of the people I spoke to are a bit reserved. They do not want to talk much about the issue. But most of them have indicated that nothing has really changed. Some of them are saying that they don't really care, which I find really interesting, because definitely it would affect whatever is going on there. And some of them are also saying that whether or not he comes in, it wouldn't affect anything. But from my observation and from what most of the people were telling me, that everything is business as usual.
It's business as usual. Yeah. But then we know that the new facility, of course, whose inauguration has brought up all of these, if I should put it that way, is still under lock and key. Did you get any information about that?
Yes, and I actually spoke to the administrator of the hospital, and I also spoke to the new medical director about it, and they are saying that the contractors are yet to officially hand over the facility. There's nothing wrong, and that they are just trying to get things done properly. On a Monday, they'll open it. So it's just like a way of putting things together, and that there shouldn't be any panic. Nobody should be worried. And they're saying it will officially open on Monday.
It will officially open on Monday, where Dr. Shrofenyo is expected to carry out his duties, perhaps as acting director, medical director there. He chaired a meeting today. Can you tell us a bit about that meeting?
Yeah, so from what they tell me, the meeting was just to talk about how to transition, the transitional plan for getting the new facility to open and working on Monday. So that was just the main aim of the meeting. But they also just indicated that they use it as an opportunity to introduce Dr.
Shrofenyo to them.
That's the meeting was a meeting of the heads of departments in the hospital.
So he was introduced to them as what?
As the acting medical director. He actually chaired the meeting, he gave them the welcome address and all that. We were not allowed in there, but after that we got some briefing from the people inside.
Which we've already played, but he wasn't willing to engage you, of course, on the Dr. Anaba and the Minister of Energy, Minister of Health issue ongoing. He didn't.
None of them wanted to talk about it. They just brushed it off when you mention it, and they're just talking about the way forward.
I see. Finally, did you speak to any of the patients there or people who are visiting the hospital? What did they tell you?
Yes, as I indicated earlier, from my observation, everything is going on as usual. And the patients have also mentioned that they haven't seen anything different going on.
Okay.
They're just going about their normal duties and getting their health attended to.
Okay, well, but they obviously wouldn't go on record with you, I believe.
Not at all.
Okay, Zarina Amandi has been at the Rich Hospital here, where there's a standoff currently going on between the the medical director, call it the substantive medical director, Dr. Thomas Anaba, and the Minister of Health, Dr. Kwajima Menu. I'm sure that issue will be resolved as time goes by, but on Monday, Dr. Emmanuel Sofenyo is to start his work as acting medical director at that hospital, away from health.